This episode presents selected anterolateral knee cases, focusing on ITB tendinopathy, ALL injury, and Segond fracture in musculoskeletal ultrasound practice. This longitudinal view demonstrates the distal insertion of the iliotibial band. The tendon structure appears thickened, with reduced echogenicity and partial loss of its normal parallel fibrillar pattern. These findings are consistent with iliotibial band tendinopathy and its distal attachment. The changes are localized to the insertional region, which is a common site of overload-related pathology, particularly in physically active individuals. Careful assessment of thickness, echo texture, and comparison with the contralateral site may further support the diagnosis. This longitudinal view demonstrates the distal insertion of the anterolateral ligament. The ligament appears slightly irregular and less well-defined compared to its typical compact fibrillar appearance. There is subtle heterogeneity and mild thickening near the tibial attachment. In this projection alone, the findings may raise suspicion of prior injury, but they are not unequivocal. Chronic changes may be difficult to distinguish from anisotropy or minor anatomical variation in the long axis view. The transverse projection provides additional diagnostic clarity. At the tibial insertion, the ligament demonstrates focal reduction of echogenicity within the enthesis. The normal, well-defined cross-sectional architecture appears partially blurred with loss of the typical organized fibrillar pattern. Subtle cortical irregularities are visible along the surface of the proximal tibia at the attachment site. These findings, in correlation with the clinical history, are consistent with a previous injury and chronic remodeling at the enthesis. This longitudinal view demonstrates an avulsion injury at the distal insertion of the anterolateral ligament. A small osseous fragment is visible at the lateral tibial margin, consistent with a Segond fracture. This type of avulsion results from traction on the distal anterolateral ligament during internal rotation injury mechanisms. Segond fractures are classically considered pathognomonic for anterior cruciate ligament rupture and should immediately raise suspicion of associated ACL damage. Careful evaluation of the lateral tibial cortex is therefore essential in acute knee trauma. The same injury is now demonstrated in the transverse projection. The avulsed fragment is again clearly visible adjacent to the lateral tibial cortex, confirming its osseous origin at the distal insertion of the anterolateral ligament. Multiplanar imaging increases diagnostic confidence and helps exclude simple cortical irregularity or soft tissue calcification. Both Segond fractures and isolated distal anterolateral ligament injuries are highly predictive of underlying anterior cruciate ligament rupture. Recognition of this finding on ultrasound should therefore prompt careful assessment of ACL integrity. This concludes our review of selected anterolateral knee pathologies. If you found this material useful in your clinical practice, feel free to share your perspective or questions in the comments. Additional references and technical details are available in the description. Thank you for watching.